Good morning, sir. Thanks for having me over and being able to interview with me. It's been a little bit since we've talked. Can you kind of introduce yourself to the audience?
Right. Well, Elian, thanks so much for having me. And I'm Dr. Robert Liotta. I'm retired from the Navy now after a 25-year career, and now got to meet Elian. Gosh, now what, 6-7 years ago?
Yeah, it's
when we
crazy.
first met. And so this is just a great opportunity. I'm honored and humbled to be able to get to talk to you today and talk to you about the things I've gotten to do and the things that I'm excited that you're following and getting to do as well.
For sure. Yeah, it's just time has been flying. It seemed like it was just about yesterday when I saw you at the Howard University during the summer health profession education program. That was the first time I ever heard about being like a military physician and the opportunities like to even pursue it. So like I really appreciate you being able to reach out and like talk to me back then, and then also being able to reach out now and be able to talk to other people that may have not heard about USUS or heard about the opportunities of becoming a military physician. So just to kick it off, can you tell me a little bit about your journey to becoming a radiologist?
Right, Elian. So, when I started medical school, radiology wasn't even on my radar. And in fact, I had thought about I was going to be an ear, nose, and throat surgeon. In fact, that was where I did a lot of shadowing there. I thought this is really neat. I liked doing gross anatomy. I liked doing dissections. And but what I also learned in medical school is I loved studying everything. It was like, it didn't matter if it was neurology, pediatrics, general surgery, internal medicine, radiology. Learning just the body and how it worked and different diseases, it was just attractive to me. But what I also then found out too, as I became a clerk and as I went into my advanced clinical rotations, sometimes the practice of medicine I didn't enjoy as well as I thought I would. The stress of running through clinic and trying to balance patient needs, but at the same time trying to figure out what's going on. And one of the things that I then found out as I was going through all of that, I thought, gosh, I really like knowing this and being able to discuss this. And that's where radiology is. Like, a lot about diseases. And then what I often say is the radiologist is the clinician's clinician. And in fact, that we get to advise and we get to think. And the thing that was nice about radiology is that you could study all of these things, know all of these areas, and then contribute still to the patient care, where you're actually being able to say, hey, people come in the room, or the ER calls and says, what's going on? Where are they hurt? Where are they? And you actually get to go down the list and say, this is broken, there's a laceration here. You need to call the surgeons for this. This is something that needs to be followed up later, but it's something that we're a little bit concerned about, whether or not they need another study. And so being able to be that consultant was just really exciting. And it sort of fit with my personality and the way I liked practicing medicine that I fell into starting looking at radiology. But that also meshed with my desire to be a surgeon, right? And so the thing that really connected those was interventional radiology. And so it ended up being that I was like, oh, I love doing procedures. I love being this consultant. And now, let's look at radiology. And back then, the only pathway to do interventional was to do diagnostic radiology for 4 years and then do a 1 or 2 year fellowship in interventional. And that's where I still didn't even know. By the time I graduated from medical school, I said, I'm still thinking ENT, but interventional is there. And so I ended up doing a surgical year for my internship just so I wouldn't close any doors. That year would go towards ENT. It also could go towards radiology. But it was really during that year then when I was down at Washington Hospital Center, and I was on surgical services, but also I was on the trauma service, and so many patients were going to the interventional radiology suite and getting embolized, or they had just been in a car accident, or they were bleeding, and they're going to the interventional suite, and those guys were the heroes. And I was like, that's what I want to do. And so that then made it very easy to go, no, I'm gonna apply for radiology and try to go down that route with it.
For sure. So it sounds like having kind of like that, wanting that holistic picture of like thinking about the patient and being able to incorporate, like the pathology and then everything that you learned in like med school in the holistic picture, and being able to like have that at the forefront and being the expert in connecting like all of that together, while also, and you said taking it into your own part in incorporating that procedure loving aspect that you like enjoyed as well.
Exactly.
And going through interventional. That's really cool.
Right. And that's the fun part with radiology. A lot of people say, oh, you don't have the patient interaction. But if you're doing procedures, you do.
Yeah.
Because you actually come in and you are like their personal doctor in that moment of that procedure.
Yeah.
And I've had such good connections with patients. But on the other side, on the diagnostic side, especially nowadays with the way the internet is and the way our health records are, so many times I'll pull up a patient and their picture will pop up with their medical record.
Oh, yeah?
And so many times I'm thinking about them, where I actually even pray for them, as I'm reading the scan and going, oh man, I know they're going through something hard here, and being able to contribute to that care. So, and that's a nice way to connect, especially as a radiologist.
Yeah, for sure. And I just recently learned about like nuclear radiology too, and having that opportunity to be able to like actually help like treat cancer for our patients as well.
Exactly.
And, while also being a radiologist, because I know that is kind of like a narrative that we hear a lot, that like people that go into radiology go in because they don't want to see as many patients or have that patient interaction. But it seems like there's many avenues where you can still have that patient interaction while still being a radiologist at the same time.
Exactly. In
Really
nuclear
cool.
medicine, for sure, we're using radio tracers that we're actually treating people for their thyroid cancer or their prostate cancer. And that's growing, new radio tracers to do that. So you're exactly right. And I would argue those interactions, you'll have that in lots of parts of radiology, even mammography. Think about women's imaging. An example of this was I was doing mammography, and I'm leaving my duty station in Lemoore, California, and I'm checking out of the administrative office, and the office is coming and giving me hugs. And I was like, wait, I haven't been here since I checked in like 2 years ago. And the women were like, no, our friend, you diagnosed her cancer. Like I did the biopsy, I diagnosed it. She's alive and well now because of you. And that was the connection that they had with me and radiology. And a lot of times as a radiologist, you don't even know what you're doing or how they appreciate what you're doing because of that. And that was just one of those nice examples, and very, very rewarding get to do that and to be able to connect and take care of people, knowing you're having that effect on their lives.
Yeah, that's really cool, really fulfilling. Sounds like. Going on to the next question, what about what motivated you to pursue a career in the military as a physician?
Yeah. So, to me, I always wanted to, I love our country. I mean, even from being like, I remember in 4th and 5th grade being on a baseball team and getting to stand on the first baseline and sing the national anthem. Like, that's just something that's always resonated with me. And so it's like, for me, that was inspiring to just I love our country. And so even when I was in high school, my parents were like, hey, what would you think about doing? And I was like, you know what, let's look at the service academies and serving. And so the idea of service and being a part of our country as a leader and taking care of our nation, that was always like a part of me. And in fact, I even made that decision before even becoming a doctor. I knew I always wanted to be a doctor from really young age. And, he was a freshman, sophomore in high school. But I also knew I wanted to serve our country. And so when I was looking for colleges and applying to the Naval Academy, I said, you know what, I don't know for sure if I'll be able to go to medical school from that college, but I'm willing to serve our country. And so that's what ultimately was what guided me. And then I ultimately found over time, oh, wait, I could go to medical school and serve. And that's sort of how my career went. But it was that idea of service, being a part of something greater than yourself, being a part of this great nation. And actually, I didn't even know how good that benefit was until I got in, and then all these opportunities kept opening up, just opportunities that never would have presented themselves had I not been in the military. And just examples of that are people coming to visit the military, and they may they may have lectures, and you're like, I can't believe I just got to meet this person, and this person's now lecturing to us. Or having opportunities even at USUS, getting to fly in my first helicopter ride was as a first-year medical student, taking care of a family that I was just meeting for 6 weeks. Yeah. And I was, during my humanism and medicine course, I had to meet with this family once a week for like that quarter. And I think I met with them over a period of 6 weeks. And I got so close with them that they actually had triplets, and 3 of their children had cerebral palsy. And so we were talking about how they dealt with that, and I got to know them really well. Well, the father was basically, he was a UH-1 helicopter pilot, and he was attached to the VIP squadron for Congress. Yeah. And one week he called me. He's like, Rob, what are you doing on Saturday? I'm like, I'm not doing anything. He's like, do you want to fly and get a special tour of the Capitol? And we did a low level over the Potomac, over the White House. I mean, just it was an amazing helicopter ride. Doors are wide open. We're turning and banking, and I'm like, who gets to do this? Oh, you know, no medical school in the country would have been able to allow me to have that experience, except that was our patient. That was our patient population, and this is who we were taking care of. And that presented itself for me and actually one of my buddies. He said, bring a friend. And so we got to go up and do that. And so those are just a few, but I mean, countless opportunities. I mean, seeing the world, getting to experience other cultures, and really being a part of, like, joining in all of the other troops who have given their lives for our country. So to support it, and the ideals that we know and believe are true, and that we're willing to lose our lives for.
For sure, yeah. And I remember you telling a story when I first met you, like back in September 2019, about the opportunity to like care for our nation's heroes as well. Do you recall that story at all?
I do. In fact, there's like countless of these stories, okay. But I do remember that story because even early on in my career, I mean, right out of internship, you know, that was 9/11. I mean, 2001. I graduated from medical school in May of 2001. We have 9/11 in September that year. I'm a brand new intern, and that was sort of when, really, which sort of marked my entire military career, being in Afghanistan, being in Iraq, that we started seeing seeing real live troops and injuries coming back. And I still remember that summer. Or I mean, actually, that winter when we went into Afghanistan, it was this Marine. His first name was Travis, and I still remember he lost almost everything with regards to limbs. But he was so courageous and so joyful every time I walked into that room, and he was so honored. I mean, he was a Marine that gave everything for our country, and for me, every day to walk in on him and take care of him was a great privilege. And so he was one of those. And then, you know, among those many, and in fact, I remember when I shared with you the story of, you know, it was an Army master sergeant who was in Afghanistan, and every day would be going to the chow hall, or basically going to eat. And there was a foreign national there that was sort of working, and that he sort of got to know well, actually, and would always say hello to. And it was really right before Thanksgiving. It was actually right around the Thanksgiving time period. It was either 2016 or 2017. Was walking into that chow hall and noticed that individual who we always said hello to looked a little different, was sort of not even answering. He's like, hey, how are you doing today? And he didn't answer, and he was just walking sort of with a purpose towards the chow hall. And so he ran up to him, and he put his hand on his shoulder and realized, oh, wait, he is wired with an IED, this individual. And so what does he do? He doesn't run, he doesn't panic, he doesn't scream. He actually gives that foreign national the biggest bear hug and takes him to the ground, and he won't let him go. But in the midst of that struggle, that foreign national detonated the bomb. And so he was injured. And then literally within hours of that happening, he was medevaced back to Walter Reed. And so, you know, so he's coming back, and I'm as a physician at Walter Reed, like, we already heard the story. Like, we know what this individual is doing. And so then the ability to come back and know, and then we're taking care of this individual, and we know how much he's given up and how many lives he saved. I mean, preventing that individual from going to the chow hall with probably hundreds of people eating, that was his mission, was to blow them up in there. He saves them all, and him being, you know, saved all of their lives, and is horrifically injured. But knowing that, hey, I may be tired, I may be working, but I'll give everything for this individual. You're always going to do that for your patients, but having these special patients in the military is a great privilege. I mean, if any, it's just a privilege to get to take care of people like that, and knowing that there's so many that do that on a daily, did that throughout history, have done that for our country. And yeah, it was just, you know what, you never complain. You're like, nope, I may be tired. I'm like, but I'm willing to give everything for my patient. And those are special patients that we get to have in the military, only here in the military, that you're going to really get those on a regular basis.
For sure. Yeah, when I first heard that story, that's what really kind of activated me and really had me consider USU and military physician. Well, look at me now. So I definitely decided to do it. But when I first heard that story and the unique opportunity to care for our nation's heroes, that really made me look deep within and think about hey, is this something that I can see myself doing? And it definitely was. And once I weighed all of the pros versus the cons, the pros being basically everything that you've talked about too, with the ability to travel, being able to be a part of something bigger than yourself, and being able to like care for our nation's heroes. And then the cons would be me having to shave my beard at the time. That was the only thing that could really came to my mind. And back then I really didn't want to give my beard back. But like now that I look back, it wasn't even that good of a beard. So, yeah, but I really appreciate you being able to like have those stories and being able to be comfortable sharing it, because it really does like it struck something in me as a pre-med, and I'm hoping that it strikes something in other people as well.
It's true. Like anything worth going for or doing always has a sacrifice involved.
For sure.
And there's always a sacrifice involved. And it is in that sacrifice that one, you're loving, right? Or you're giving up. But that adds to the greatness of whatever you're doing. You know, we don't think about, you know, say you spend your whole life on vacation. Like, are they proud of that?
Yeah.
No, you know, like, no, it's like, yes, it's great. And we live and we get to do those things, but it's really in the sacrifice and the hard work and giving of yourself for others that you'll find true joy. I mean, sure. and that'll be your whole life. You know, I mean, I think that's across all spectrums. In the military, it's very evident, but it's across, like, whether as a father, as a husband, and whatever vocation or profession you have, if you put that attitude into it, it's going to be joy-filled. It's gonna, you know, it's really gonna, and it's gonna be special, and you're gonna affect others' lives.
And I know you talked a little bit about it and the opportunities of a military physician, but why do you think someone in pre-med should consider USU? And then to add on to that, what about HPSP?
Right. No, I think if you're looking excited about the adventure, like, you know, you want to practice medicine, but you're also excited about serving or being a part of, you know, being a part of what this nation stands for and being a part of our military, I think it's a no-brainer because of the opportunities you have. And you don't have to spend your whole career doing it. If you spend 4 years doing it with HPSP or 7 years from USUS, I think those years you'll look back fondly going, it was just a great period of my life, because you're getting to do things that you wouldn't just regularly do if you were in your hometown or in your practice. Mm-hmm. You may get called to do things that you never expect. And I think if you're excited for that adventure and excited to be a part of that, then I think it's a no-brainer because you will get so much more out of it than you would ever even dream of. And that's sort of how, like, my career went. Even the things I didn't want to do, you end up going to do them, and then you're like, oh man, this was really much better than I thought. And it's mainly because of the experiences, the people you know doing it. I mean, it could be the worst experience, but if you're with a great group of people, it's actually a wonderful experience, you know? And so those things, I think you don't know what you're going to get or what you're going to deal, but I will tell you, whatever you get dealt, if you go into it with the attitude that, no, I'm going to make, this is going to be an experience, it will be a good experience. And so that's the reason, I think, for all of those reasons, you know, the time you owe in the military is nothing compared to what you will get out of it. Mm-hmm. And I think it's just one, you'll be well trained. I mean, not only these experiences, but the country needs you to be a good doctor, and they're not going to invest in you if they're not going to get that. And they will do everything to make that happen. So USU, the mission of that school is to create good doctors to support the military, fantastic doctors. And so the school gets closed if it's not meeting that mission. And so what I say is, if you come to USU, you're going to be well trained. Almost every medical school in the country, in the US, is good. Mm-hmm. But USUS is especially good because the nation is investing you. Yeah. If they think they're not getting the product they need, they're going to invest in that. So do we need better professors? Do we need more research? Do we need just whatever we need, they will get that. You know, we were even looking at board exams. And then I think when I was there as the dean for admissions, I was on a committee that looked at, well, how can we help with those board exams? And mm-hmm. we paid for extra, you know, problem sets for you guys to use. And we're like, the price doesn't matter. It's actually, if the students think this will help them, we want to get that for them. And so that's, you know, the school did that. And they're like, no, that's an investment. If that's going to help them study for these exams and augment what we're doing. But we didn't just jump to that. We looked at, hey, how is our curriculum doing this? Mm-hmm. Are we teaching appropriately? Are we making sure these fundamental things required for the boards are being highlighted and actually a part of our curriculum? Because there's so much information to learn, and there's very important things that us as professors think are important, but it's our duty to make sure that you're getting the basic things that the national board exam, licensure exam, knows you need to know.
For sure.
And that we're highlighting that well enough for you to do well in those exams. So that's just an example of that. But it's like even deciding, do we use cadavers? The school looked at, yes, cadavers they're big, they're such a necessity for training, but there's a big cost with that as well. And many schools don't even use them anymore because of that cost. But the school really looked at it and said, no, this is, getting to decide if you want to be a surgeon, being able to do dissections. Those are such important, and they're integral as you're deciding what you want to do and what you may find that you're actually really good at that and that you want to be a surgeon because of that innate skill that you have. Those are all things that we're like, no, that it's imperative that they actually do gross anatomy with cadavers to really learn that anatomy, and it will help people as they're growing and discerning what they want to do. So for those reasons, and I think HPSP and USU, great routes. I mean, if someone's interested in both, my recommendation is you apply for both. Wherever you get accepted, then you decide which is the best fit for you, which is the best school, what fits with what you're doing. Because there's, we couldn't talk about all the options and all the good on both sides, and they're going to be unique to your situation, where you live, what's your family like, all the things that you need to look at. But in my mind, they're a no-brainer. Like, both are amazing options. And if any of my kids want to go to medical school, I will be like, you need to apply to those and then decide what you want to do. But this is a no-brainer.
Yeah, for sure. For sure. Yeah, I would say too, like throughout I'm a fourth year now, basically. Yeah, because the last year just graduated this past weekend. Yeah, that entire time I have felt like completely invested in. Yeah, for sure. Like I always tell people too, like sometimes you feel like you're like overly supported at times too, right? So you'll be, maybe you have a bad day, you ended up like failing by like 1 point, and then you'll get like emails from like people like out of the bushes, and they're like, "Hey, what do you think you can do better so you don't like fail next time?" Right. I was like, I'm thinking like, I don't know, maybe next time I won't fail, like, But you have so much support at USU, and I will say that, like I said, I'm not like paid to say any of this stuff. I'm not paid to be up here. I'm kind of like doing it because of, it's kind of like amazing to me, like how I had no idea that this school like existed. And the only reason I was like lucky enough to hear from it is because you told me about it. And then also I had the opportunity to be like born in Maryland, where the school is. The school was about like 15 minutes away from my my university. I never knew about it, So just trying to like get that out for other people too. But I do agree with everything that you said as well.
Yep.
So kind of going back to like radiology and asking some radiology specific questions. I know you said you've been practicing for a while, and you still continue to practice as a radiologist, right? Exactly,
in retirement. So and continue to. I'm subspecialized, having my fellowship in cardiothoracic, but it's been fantastic. So both in retirement. So I've gotten to see the military side and the civilian side of medicine. Throughout that, and radiology has changed a lot. Even from when I was a resident, I mean, even just the imaging is so much more impressive, and the scanners and the MRI and the sequences. I mean, some of the sequences I use in reading cardiac MRI, they didn't exist when I was a resident. So radiology is constantly evolving and improving. And so you will, like all of medicine, what you even learn in residency, will get outdated, and you will have to, it's lifelong learning. And so learning new sequences, learning how to use new, utilizing new techniques, and how that's helping the clinicians. So that's continuing to grow in radiology, and radiology, like all specialties, is evolving very well. And with us, technology, and especially if you like technology, it's a big part of what we do. And I would argue the big things with AI and machine learning, I think, are exciting because now we're looking at, gosh, well, I mean, a prime example is that, as a radiologist, I'm a chest radiologist, so we're looking at nodules, right? Well, the investigative or research question is, well, is that nodule cancer, or is it just a granuloma, something benign, right? And from the naked eye, it's hard to tell. You can't tell, like, hey, it's round, it's got some irregularities, it could still be a granuloma. You need to put a needle in it to figure out what that is. But what we're looking at with machine learning is, can the computer actually look at the surface area and map that? And can we actually then look at that deep data of that nodule, and actually, is there anything completely different between a cancer and a granuloma if we actually look at the surface area, the contours, irregularities, which the naked eye can't see, but the computer could potentially see? And can we get to the point where, no, all you need is the scan that tells you that's cancer? You don't need to do the biopsy anymore. And think about, patient doesn't have to sit through a procedure, all the risks of having a pneumothorax or when we're talking about the lungs, like going into them. So these are exciting things to me, where
amazing.
that deep machine learning or being able to just process an MRI and actually giving us extra data, like calculate quantitative the amount of fat around the heart. And can we actually link that with, hey, what's your chance of having a heart attack or high cholesterol or cardiovascular disease? And these are things now we can study, because before the computer now could do that. Like it can quantify that. Whereas it was just before we didn't even have something that could do that, or the deep learning with that. So these are exciting times with AI and machine learning, deep learning, big data sets, where before computers wouldn't process that. And to do all that on a quick scan, and then all of a sudden now the computer's spitting out like reportable facts that now we can get trends on if we're scanning you every year or seeing changes in that. So there's so much. I mean, it can go infinitely with research and the sequela of knowing this data, and how do we prevent disease and manage disease better because of that.
Yeah, I agree. Like I didn't know about that surface area application of it too, but I feel like AI is like really amazing, and the potential of like how it can benefit like patient care, and then also lead to like better like safety for patients. You mentioned a little bit about maybe not needing needs for like tumor biopsies as well. And I knew too is they're also working on using AI to make the resolution of images even better. So you can have like less radiation. Yeah, to
and
your
have better.
patients. Yeah, it's actually it's really interesting. It's really crazy, and I'm really excited to be a part of it, and like being a part of the next generation to like keep
that are doing it.
Like honing it, everything. But yeah, it makes me excited just talking about it.
Yeah,
it's really cool.
It's really good.
It is for sure. Thanks for answering that question. Another question, I know you talked a little bit about being on the board of like admission for medical school, and I know some of our pre-meds probably have questions too. So I'll ask you a couple questions about one, what traits or skills do you think make a radiologist excellent in your opinion? Yeah,
so I think, the best radiologists are, one, they're going to care. So they're going to be thorough. So they're going to follow their search patterns. And I think it's easy. We call it satisfaction of search. But if you're always doing the same process and looking at everything on the image, you're going to be safe. Like you're never going to miss a big thing, whereas if you sort of lose that pattern, you're not following your regular search pattern. And that happens often. You get a phone call, someone comes in, they disrupt you. You can sometimes get off that pattern, and then you didn't look at, I forgot to look at the soft tissues, and there's a little nodule there. That's an asymmetry in a woman's breast. And that could have been the breast cancer that you could have caught early. But if you didn't have that search pattern. So I think what makes a good radiologist is someone who is very, cares so much about the patient that they do a thorough job of looking at all the danger areas, looking at all the major parts of that scan. So I think, and that takes, it just takes discipline, right? But also you develop that discipline by getting into good habits of I look at this the same way every time. And then you build that search pattern. So now you don't even think about it anymore. It's the way you look at it. And that becomes ingrained in you. And those are the best radiologists that know that's how they look at it. And they follow that algorithm every time.
For sure.
And it was funny because you're going to miss things. You are going to miss things, and you're going to make errors. I made my fair share of errors. But I think if you have a good algorithm, you won't make major errors. You won't hurt anyone significantly. Oh, yes, I missed that normal variant. But the fact that I didn't comment on it is okay because it's a normal variant, and it didn't matter if I commented on it or not. So that doesn't hurt the patient. But knowing those danger areas that, no, I can't miss this. This is a do not miss. Misfinding. And so that gets good. I think, and then when you care, you really want to think about the patient. I mean, I think it's the funnest part of radiology. Clinicians come down, they don't know what's going on. And they're like, can the imaging help them? And they're so grateful when you're like, no, it can only be this, or when you can really be, and your trade when you're like, and sometimes you're like, I can't tell you. It's one of those three. But you can also, if you know your trade well, but I favor this. Like if it's that's atypical. Like you can at least say, this is the one I favor the most. And it's because you have this skill set of going, yeah, but it's the most common here. It's on the right side. That disease is almost always on the right, and I can't say for sure. It could be irregular and atypical for that one, but if I'm going to put the odds, I'm going to bet on this, I'm going to bet on it's going to be that one. And that really helps them when they're going down the algorithm. They're going, okay, we're going to hang our hat on this. Radiologist actually, is this their favorite diagnosis? And then you tell them, it's a lot of fun when they don't know what to do next, and you're like, oh, well, get this, or you know what, this specialist is going to help you, or get this study, and then we'll know for sure. You know, it will confirm what I'm thinking. And so those discussions and caring, like that's the fun part. You know, and those are the cool cases, and those like when you go home and you're like, yeah, I helped today. Like they didn't know what to do, and I was able to help them, and it's the most rewarding part.
That's really cool.
And those are the best. Yeah.
Yeah. And I think you mentioned, it might've been years ago, but like radiologists are kind of like the clinician.
Yep. Yeah, exactly. Yeah. Exactly. And that's the fun part. You're being able to help them. And then they really appreciate it. I just gave a talk, actually 2 weeks ago to interventional cardiologists. And it was basically the differences between acute and chronic PE. And, it was just a fun lecture because I simplified it to the big things that I look for, and they loved it because one, they don't get trained on that, right? They've been looking at these on their own, and so they were like, oh my goodness, like they wanted to take pictures of it, and they want, and they're like, I wish you were in my back pocket when I look at these because those little subtleties are what I'm like, oh no, this is clearly chronic, and they're like, how do you know? And I'm like, well, because these 5 things that are not there when it's acute, I can see, but they're just little subtleties, and that's where we are. That's where a good radiologist is. Like,
that's
you know,
really cool.
People can see the big things. Everyone can see the big tumor there. That's abnormal, right? But it's the subtleties of then distinguishing, and that acute versus chronic PE is a big deal when they're trying to decide to manage. Because a lot of times people are, oh, there's a PE there. Is it acute or is it chronic? Well, I don't know, you know?
Yeah.
But then to be able to decipher that and go, oh no, that's clearly chronic, which changes the treatment algorithm versus acute PE on the treatment algorithms for them, like long-term treatment.
Yeah. That's really cool. That is really cool.
And those are little things, but that's like, it's our trade. I came home from that lecture and I told my wife, I was like, it was a lot of fun, you know, because, and especially being with helping other clinicians that don't know it. Like if I was talking to radiologists, they'd be like, Rob, that was a good lecture, but we all know it, you know, because that's what we know. That's our specialty.
Like what you study,
and we're supposed to know that.
Yeah,
you know,
exactly.
So.
Sounds like being able to be like that, kind of like that missing piece of the puzzle for the last part and that integral part.
Yep.
Putting it all together is like really like rewarding and like fulfilling too. That sounds really cool too.
Yep. No, it was a lot of fun.
Yeah. The attention to details matter.
Attention to details and those little subtleties, but it's fun like when you know those and then you pass it on. You're like teaching your residents and you're like, hey, always look for this. Like, and you will remember those things. Like I remember some of my mentors in my, you know, they're like, always look for this. And like that sticks with you. Yeah. And then when you're looking at it, then I teach it and I go, always look here. Do not miss here, you know? Yeah. And those things stick with you. And then when you do miss one, you remember it even more because you're like, I do not want to miss
trauma,
that again.
Like burns,
you know, it gets burned in.
Yeah.
So, you know, with it.
Yeah, that's really cool for sure. Yeah. Okay. Yeah. Kind of going on that kind of similar note, what would you say is the most proud moment in your career so far? Yeah.
You know what? When I look at, I would argue it is I'm most proud of all of the relationships I've been able to make through the years and each of the individuals who I've been able to personally help. So, you know, like there's lots of accomplishments, papers, different things that you do, but I would argue it is looking back at each individual person that I've helped, whether or not that's one study, you know, that I've made a call on, or a medical student that I helped, or a pre-med that I helped get in. Yeah. You know, like there's so many little, and I would argue, like if I could put all those together, like, and I had a pile of those, like I would be most proud of those because those really made differences in a lot of lives. And I feel like being a physician allowed me to do that more than any other profession that I could think of. Because, and not only on the medical side, but then even mentoring and helping and teaching. It's the reason I love being a teacher. So having those effects, and even just on my colleagues, like just even personal help, like on how to address like just life issues, right? Like I'm most proud of like being able to like contribute to their well-being, and I when I look back at those, like I'm the most proud of those, like all of those little events, you know, even our friendship, you know, and like I'm like, you know what, like this is awesome to see, and I at least got to contribute and help, and you've done so much, like you've made it happen. I haven't done anything, but I get to see it. I get to see the fruits of that. And I think that's like, I'm most proud of these, like, and my positions as a physician have allowed me to really do that a lot. I mean, just more than I would have ever imagined to do that.
Yeah, that's really cool. Yeah. And I just wanted to like give you the roses now and say thank you again for your like continued like outreach and going above and beyond in doing that for us and like for our students. And then I know I'm just one of many, but it does really mean a lot because Yeah, it means a lot.
Well, and it shows, and you know what, and that's why, it is, and it's really exciting for me. I mean, I learn from you. I see all the things you're doing, and it's actually so fun to see, and I think that's the reward. That's where like the benefit of that, the reward comes back to me as well. You know, that I get to see it and get to see you, you know, meeting your dreams and, you know, going from, that pre-med student that I saw 6-7 years ago, right? To now, to actually, I mean, 1 year away from, I mean, less than a year from being of an MD. And it's awesome. Crazy. And you're taking full advantage of these opportunities, which is, I mean, it's wonderful to see. And you're in the next generation. You're gonna be taking care of me.
Yeah.
You know, I mean, that's what it is.
Full circle,
it does come full circle.
Yeah, that is amazing. That is amazing for sure.
So
that's really cool. All right, going to the next question. I would say, let me see. You kind of answered a lot of these.
I know we have.
Yeah, you answered. You're doing great. Okay, yeah, we talked a little bit. You've got the aspect of having practiced radiology both for the military and civilian. Yeah. How do you think practicing radiology in the military differs from the civilian practice, if there's any differences at all? Yeah,
you know, I mean, I think they're very similar. I mean, and the fact the training on both sides, I mean, I feel like I got wonderful training in the military, but the military also partners with the civilian side. So even throughout my military career, I was working in civilian hospitals along the way. So there's not a huge difference in the sense of the day-to-day work of the military medicine versus the civilian medicine. It's actually very similar, you know. And I would argue that probably the military, because of its mission though, really focused a lot on the training, you know, it focused even more so for the fundamentals. And so I would argue I was so grateful to the military for my fundamental training. And I would have gotten that in the civilian sector too, but it was just very real to me. And the military always put their spin on it like, hey, you need to be able to do everything. And so I think the general global approach that like, you know, on the civilian side, you can pigeonhole more. You can be like, I just want to do this and go that direction. But in the military, yes, I wanted to go one direction, but it's like, but you know what? You got to worry about all this other stuff too, because you may be the only one that can do it in this austere environment. And so I actually appreciated that general approach. So that, you know, you need to be a jack of all trades and so meaning even as a radiologist, there's 10 disciplines in radiology, right? You need to know them all well when you deploy. And you can't subspecialize or focus on that. So I think that's the beauty of military medicine. I had to do that. Like, I think had I been a civilian, I may have just pigeonholed myself and went to being a subspecialist and never really did the general. But I appreciated the 3 years I worked as a general radiologist. And actually, I would argue it was harder because you have to know everything, but more rewarding in the sense that because you're dealing with the whole patient. Like anything that came in, you got them. And even more now, like I focus on the chest now, you know, but I do like, I did mammography then. I looked at the head. I did pediatrics. I remember kids I took care of. So I think the military side, that generalism, and if you ultimately even stay in general radiology, one, you're a hot commodity because you could do them all well. And even now, like I get calls for moonlighting. If you can do everything well, you will, you know, anyone wants you, you know, with it. Cool. So, and so they need that, like hospitals, especially rural hospitals that don't have a lot of specialty care. They need you. They need you to do it all there. And so I think that's what you're going to get in the military. Like you have to be like, even in residency from Walter or military residency, they need to know that you can go down range and you can do anything they need, which means like I'm a good sonographer. Like, and that was because my residency made sure we all scanned, you know. Cool. I'm, you know, civilian programs, some make you scan, but at Walter Reed, you have to scan because they need to make sure you won't have a sonographer. You may have an ultrasound machine. You need to be able to check that gallbladder to make sure it's not inflamed. You need to be able to do that ultrasound exam yourself and make the calls because there's no one else to do it. And so those are things that I really appreciated that were different, a little bit unique to military medicine. And in fact, I got good at those, but it makes you a better radiologist because now a hard case, when you do have to go in as a civilian, you are a good scanner. You can do it. You know,
fall back on that.
You can fall back on that skill and go, oh, I know how to do this. Wait, I need to look at this. And then you feel very comfortable doing it, you know, going in and checking yourself. Like, I want to check this myself. Because like the text could sometimes show you pictures that look good. You're like, but I just want to see this myself because, you know, sometimes the pictures can be, they may have been looking at something wrong, and you're like, no, sometimes you have that spidey sense or gut feeling, like, I just want to look at this myself, you know, and you're a better radiologist because of it.
That's cool.
Yeah.
In fact, I'm saying that's cool a lot, but yeah, that's
it
amazing.
Is, but it's unique, and is it harder? Yeah, we expect more of our residents, you know, to be able to do that. But we also know, because you need to be good at this, because you may have to do it. And don't worry, and that's what's good about it, is you're going to do your best, and you care, and and when you have to go do that scan, if you have to do it in an austere environment, you also will have opportunities to look at your books, or a lot of times I kept things. I'm like, okay, I'm going to keep this if I need it. And so I actually have notes on how to do it. And I'm like, you know what? I'm going to pull this out. I can't remember this now, but if I have to do this, this is exactly how I'm going to do it. Yeah, you know,
I think that's the purest and the best kind of training,
you know, to be able to do it. Yeah. And you won't forget it.
Yeah,
you know,
I think
you're not going to forget it.
That's great.
But we're designed to make sure you can do that. Yeah.
Yeah.
And that's what I like about the military. You know, at Walter Reed, we have less fellows. So our residents get to do a lot of procedures that the civilian sector only fellows get to do. And even at great programs, the residents don't get to do those procedures. Even like, for example, stereotactic biopsies, mostly fellows at civilian programs, big training hospitals. At Walter Reed, we don't have fellows in breast imaging. So when I did my first mammo rotation, which was as a third year, I was doing stereotactic biopsies for all of my rotations. So I had a great wealth. And I had to do those when I graduated. Yeah, I had to do them. And so I could do them. I felt very comfortable doing them. And I was never fellowship trained, but that was something that was really good in my training, and I appreciated it. And I was a good general radiologist. I had a good skill set to do that.
That sounds like amazing.
I was very
training.
grateful for that. Very grateful for it.
Yeah. Looking forward to it, man.
Yeah.
I'm really hoping. Yeah, for sure. We talked a little bit too about you serving as like the kind of dean of admission to for USU, and kind of being on board with a lot of med school applicants, and being able to have the privilege of interviewing a lot of them. And I know we've got a lot of pre-med students watching as of now too. What's one piece of advice that you wish you had received when you were a medical student?
Yeah, one of the, I think the one piece of advice, and I didn't really read it until later on in my mid-career, but was that to take time to celebrate all of your accomplishments while you're going through the process. Even now, pre-meds, enjoying these times. I did enjoy them, but I didn't enjoy them, I didn't make it a priority to enjoy them or to think about going, no, you know what? Take time to celebrate this win. So what that means is, constantly along this progress of you keep thinking, oh, once I get into medical school, but then now it'll be good. But then now I got to pick I got to get into residency. Then now I got to pass. I got to get through and pass my boards, right? Oh, now I'm attending. Oh, now I got to make associate professor, or I got to find a job. And so there's all these milestones, and you're great, I graduated from medical school, but I'm worried about internship, right? You keep worrying about the next thing, and it's easy to do because you're just I have to do all these things. But I think what I wish I would have someone said is, no, take time to celebrate each of those victories. This weekend or give yourself, I'm going on this vacation, I'm enjoying my graduation, and celebrating it with your friends and family. And I think doing that, you're closing it, but you're not saying forget about that, I got to keep going. No, you're taking that time to relish and give thanks. Give thanks to God, give thanks to all the people that helped you accomplish that as you go along. And it will just be, I'm not saying spend a lot of time on it, but if you're no, we're going to celebrate this. Our family's going to celebrate me finishing my medical school. But it can even be as little things like I finished this rotation, I finished this clerkship, I finished my step 1, I finished my step 2, right? There's all of these milestones along the way, but at the same time, enjoying it, not even looking so far ahead, but going, I'm going to relish this time. I'll never have this period of my life again. And relishing that time as you go along, and giving thanks, but also enjoying. And then because it's really the process, it never ends. There's always something more you have to do. So, but it's sort of enjoying, this was good. This was a great accomplishment, or this was fun, and then you'll enjoy those times and take time to celebrate those successes. And I early even on my career, when I would make promotions, I wouldn't have promotion ceremonies. I'm and it's a lot of work to do it, right? But I'm no, now I was man, I only did it for my last 2. And I'm I should have done it for my other ones and you'll have pictures of them or you'll remember them. And And no one ever told me that. They're like, because so many times they're like, oh, I just made rank, who cares? Like, I get paid well, great. But like, I'm still doing the same thing. But so no, like take time to celebrate that. And I did it later on career because of my family, but I was like, no, but it was like, no, you need to do that your whole career. So it was one thing that I read and I was like, oh, I'm going to tell people to do that. Like at every age, enjoy high school, enjoy college, enjoy medical school. These are periods of your life and you don't have to keep looking ahead. No, just like I'm going to relish this time and then, and give thanks for it and then go. And because your time will keep going, and when you look back, you're like, man, where did it go, right? Yeah. But enjoying it, not in a bad way, but just, but you'll think fondly of it, and it will also allow you not to get burned out. Because you'll take those times to relish and enjoy and give thanks and be grateful, and then you go on to the next one. It's not like, okay, now what's the next one? Like I just stopped and I got to go to the next thing, and then all of a sudden you're like, oh, I did all of this. And I'm just like, I'm tired, so relishing those good things.
Yeah, received.
Yeah,
received. Sure. I feel I definitely needed to hear.
And a part of that's just a daily recollection, just actually going through each day. I mean, it could be 2 minutes, but going, man, that was a great interaction today, or I enjoyed that dinner, or I just enjoyed talking to my friend today. Like that phone call was inspiring. And if you're just taking 2 minutes to look at that day, and that was fun with my wife, or man, that hug from my daughter this morning was great. Like if you're taking time to do that every day, you're really gonna enjoy life. Like, I mean, it's gonna be special. Or also improve. You're like, man, the way I responded to that kid today, man, it wasn't good. Like I'm gonna try to work on that. Like, or I'm not gonna do that again. And you'll be able to recognize areas of flaws where you'll grow, and they'll be like, Elian, how'd you recognize that? It was, you know what? I just thought I didn't really like that way that was. And that's maturity and growth. And that's where you make progress, right? And it also helps you see blind spots in your life that you're like, oh, you know what? I'm not doing a good job in that area. Like, how am I treating my brother? Or how am I, just little things like, you know what? And then you'll get goals and say, you know what? I'm gonna make a call, or I'm gonna call that buddy that I haven't reached out to in a long time. Or maybe even call that old mentor that you haven't talked to forever, but they just say, I just want to say thanks because like it's helping me now, or whatever, putting that in. Yeah. So it's something little, but those, that's my advice.
Yeah.
With it.
For sure. Yeah. And then just thought that came to me too was just that the chances are that when we do like finally pass, we'll have like a full laundry list. Yeah. Regardless. And it's just like you said,
you're gonna see it.
There's always something to do and there's always something more to like achieve. Yeah. I think it's like kind of like beautiful in the sense of like us just being humans and being like humans of purpose are always like having things to do, but it is also at the same time is a balance, like realizing when there's time, when to take the time to really like sit back and be appreciative of like how far you've came and like how far you've came with other people and how they've supported too. Yeah. So Yep. Definitely and just making time. I mean, keep that in. And, sure. One mentor told me, keep a journal, which I do. Yeah. And that's like such a good thing. Like, and to see where you've come, where you're going. You don't have to write it in every day, but it's sort of beautiful when you go back 20 years and you're like, oh my goodness, this is what I was thinking. Like, cool. It's pretty cool. It's pretty cool to see how you've grown and matured and just even experiences you don't even remember anymore. And you're like, oh my goodness, it was enough that you wrote it down and then you still don't even remember it. That's what I was like, I don't even remember that anymore. But back then it was like a big part.
It was a big deal. Yeah, it was a big part of your life. Cool. Yeah.
Yeah, I definitely did a journal. For sure.
What's it?
Yeah. Okay, next, we kind of talked a little bit, but who would you say has been your greatest mentor and do you still keep up with them?
Yeah, so great question, and in fact, I think probably one of my errors in my career, not looking for more mentors. Mm-hmm. I've had tons of mentors. And to say that there's just one that was the greatest, I couldn't answer. I would say, because when I think about it, it's like my mom, my dad, school teachers in high school, my attendings in residency, my attendings at USU. I mean, I still remember my physical exam instructor and how she taught me how to do a physical exam and a history and a presentation for rounds perfectly. And she beat us up. And yet I'm so eternally grateful to that. So there's so many, my sponsors from the Naval Academy that were like second parents to me, there were so many. And so there's not one. Old coaches, so I think I've been blessed with many mentors and many people that went along the way. And I'd argue that I haven't kept in touch with all of them or even said thank you, because they would come and go during periods of my lives.
Yeah.
Obviously, there's the ones that stay with you your whole time, your family members, or people who are in your career set, like that are ahead of you going forward, like your colleagues or that were your old mentors and now they're in retirement and you ask them questions. So I've had mentors in all of those arenas. And so, and one, I'm internally grateful to them. And in fact, even having that question made me go, yeah, I need to reach out to some of them and just say thanks, because I haven't been a good job about keeping in touch with all of them, and even going back and thinking, man, some of them I don't even know how to get in touch with because I don't remember their names. You know what I mean with it? But it's been a good thing. And I think going on and having that idea that, hey, you're going to give back too. You've had so many people mentor you, and you can give back. And so usually, but I am eternally grateful to that. Even to my sponsor father from the Naval Academy, because we have sponsor families there. I mean, he helped me write my personal essay to medical school. I'm like, I wouldn't have gotten here without him, right? And helping me do that. And I still remember that night. It was like a Saturday night. We worked on that together and he helped me edit it. And I'm eternally grateful, for that time that he spent doing that and really helped me do it, put it together. So many mentors like that. And also but I think family too. My mom and dad, I think when I look back, I'm like, they helped shape me, and still call them. I'm like, hey, should I do this? Or what do you think about this, Dad? Or Mom, we're doing this with the kids. How'd you deal with this? So many questions pop up that have been such good mentors, and grateful for having those people in my lives, that I can bounce them questions and even just how they raised me. And it goes, man, I did nothing to deserve that. And yet they were so good to me. Right. And then taught me these skill sets that I think are just natural, but it's like, no, not everyone was given that. They don't even know to do that, with it. So, so mentors are great and they're precious. Yeah.
For sure. And I'm really happy to be able to hear you, who's a great mentor to so many of us, also be appreciative to mentors in your life too. Because I feel like a lot of times, especially when you go down kind of those high career paths, it kind of may sometimes feel like you've got to do things yourself, or feel like you've got to reinvent the wheel, or you've got to it's everything's on you. But I think what's definitely helped me throughout my time is having mentors, and then also paying it forward too, and being a mentor to people down the line too, and just realizing you're kind of a part of kind of a bigger grapevine and type thing. That, each of us needs all of us, and then we're all a part of it. So I think that's something really important, take into mind too when it comes to mentors, and then also mentorship. I feel like every physician, every leader in this space pays to that too,
Exactly. You'll do that, and that it's a part of medicine. I mean, it's the way we teach medicine, the way we learn medicine, the way we work with our peers. You can be a mentor, a peer colleague, but help help them. And I've seen it across the spectrum, in my career, and it's fun because that's the nature of medicine. We're helping each other out, right? We're constantly, and we're working for someone else. The problem is someone else's medical care, and we're trying to do our best to figure out the best plan. In management, or figure out in radiology the diagnosis. What is it? So,
sure, cool. Yeah. Now to talk about some kind of forward-looking things. So, can you tell us a little bit about what you do now? Now that you're retired, because I think it's the coolest thing.
So and this is another benefit of military medicine. I do 25 years. I have a retirement the rest of my life. And it's a big gift, something I didn't even recognize how good it was until I retired. And so that allowed me, I have 6 kids. That retirement had allowed me to also just consider doing other things, not just working full-time as a radiologist. And so because of that, I work part-time as a cardiothoracic radiologist, an academic radiologist at a big medical center. And I do that one day a week, and then more in the summer and breaks. But because I had my retirement, and because I also have this skill as a radiologist, I also decided to actually go become a teacher. And so I actually teach at the grade school, middle school, and high school where my boys go to school. It's an all-boys school here in Potomac, Maryland. And so I get to be a mentor there. I get to talk to them. So I teach. I get to see my boys all the time. Get to be more home for all my kids, my daughters too. They go to other schools in the area too. So I'm home and available to be able to spend more time with my wife and our family. And it allowed me to do that, to make that decision. And so I teach there, and then I still maintain my radiology practice, and it's a really good retirement. And then, now I have summers off with teaching. I work a little bit more in radiology, but I still, I'm able to take time off. So whatever we make our schedule for the summer on where we want to go and travel and the things we want to do together as a family. And really, my military career allowed this to happen. Like hey, my retirement was more open. And even when I was looking at civilian jobs, they're like, well, we can't give you any benefits. And I'm like, I don't need any. Like, it's actually, I don't need to work full time because I have the military benefits. I have my health care. I have my retirement from the military. And so that's been really nice. And so, yes, I feel very fortunate. I mean, that time, and I'm getting to do what I love, and getting to do what I think is more important than even my career. I usually when I'm talking, I say, if you put things in priority, for me, and not everyone has the same priorities, but I think these have been worked well for me. God is number one. Mm-hmm. Then if you have the vocation of marriage, your spouse as your number two, then your family, your immediate kids, and then your job. And if you keep those balanced in that order, you will be successful. Like you will have a strong family. You will be happy with everything you're doing. You won't have any regrets, and you will. You're going to be able to continue to help others and enjoy the great journey, the joys of it all. And you put those, together, and it served me well. And I think those who gave me those ideas, my mentors along the way, that I followed that advice. I think it's a sure thing. It's a sure thing. Yeah.
That's really amazing. And I think that like speaks for itself, really. Like you having the military radiology kind of like, falling back on being able to work as much as you want to work, and then you being able to now prioritize your life in the direction that you wanted to do. And it sounds like you, even in this true sense of always learning, you even picked up another job of teaching now.
Yeah,
so
exactly.
now
I know.
Got a whole other career that you got to start
classroom management, how to teach at secondary level. I mean, I've been a teacher my whole career. In fact, even when I interviewed for that job, they're like, how do you know you want to teach? I'm like, I've been teaching actually the best students in the world, medical students. And so I'm like, I've been teaching and in residency, I was like, doctors are teachers, you teach your patients. And so, but now even at the secondary level, it's been fun because there's a new level. It was a hard year transitioning to, wait, these guys don't listen like medical students, or how do you keep them motivated? And there's a skill set in being interesting and fun and exciting to actually, and a lot of times just a classroom management means I got to be on the best game as a teacher to actually make this an interesting class, to keep their attention so that they aren't throwing spit wads or throwing paper planes across the room. So, which has been good. That's been, and it's fun, it's like a new challenge and a new skill set to learn.
That's really
with
cool.
it. And sometimes I'm like, what did I do? What was I thinking?
How did I get here?
But at the same time, also, they're really having young kids. I mean, having a 12-year-old that you can actually help inspire, that's a great gift. And actually, it's the best part of that job right now, being able to inspire them and to say, hey, look at what I did last night, and really going, you can do this. And teaching them, hey, these little things I'm teaching you now are going to be very important if you want to be successful in whatever walk of life you choose.
Yeah, down the line.
And being able to apply the medicine side and share it with them is always a lot of fun. Yeah,
that's amazing.
Yeah.
So. Like those kids are really lucky to have you as a teacher too. That's great.
So it's been a lot of fun, and it is sometimes that even just the discussions, I get chills sometimes when I see light bulbs going on, or seeing them get excited, or seeing how talented they are. Even a 6-year-old, or a sixth grader, you can see some genius in them. Very you're like, this kid's talented. You can see where they're going to go. Yeah. And it's actually a lot of fun to see that and to help get them excited to keep going.
That's cool.
Yeah.
Yeah.
So,
that's amazing. Okay, last question. Thanks so much for being getting through the interview and everything. It's been great words of wisdom, and I'm really happy that you were able to make the time.
For sure.
I'm really hoping the audience appreciates it, and I know I sure do. Last question would be, any final words of wisdom for someone exploring both radiology or military medicine in general?
Yeah, you know what? I think just follow your passions. You know, like if you don't, I think some people make mistakes of like picking jobs for other reasons, or even if they may even just like the people they work with. But no, think about the job and think, if I took away the people, would I still like that job? That will help you sometimes discern, hey, am I making it for the right reasons? Like, no, I actually can see myself doing this no matter who's here. I like doing this. It helps. You're never not going to know for sure, but but I think it helps discerning that. And the same thing with medicine, or military medicine. Hey, look, search out people who do it. I think a good website, Medicine in the Military, is a website we helped design. It talks about careers and lives of people in medicine. And then, as Ellie and I were talking earlier today, other good podcasts, War Docs, wardocs.com. Those are all military physicians who run that, and they interview lots of military physicians in their careers. It's a huge catalog of everything you could do in military medicine. And I think it's really just listening to some of those podcasts can help you decide, oh, you know what? Oh, I didn't know you could do that. Or I didn't, there's so many different topics and different careers. And that can help discern, hey, is a career in military, either a career or even a short-term period of military medicine, is that something I just want to get to do, And I think, but for me, like those experiences, I was a flight surgeon. I got to fly aircraft. I've gone, I know what it's like to be airsick. I know what it's like to be seasick, right? These are things that I don't know if I would have ever done on my own, or had the opportunity to ever do for free, and to serve my country doing it. So those are things that just, that's why I say it's a no-brainer. It's like, these are great, great opportunities, to be a part of. And even wartime settings, we didn't even talk a little bit about those, but like when you have the chance to help pick people up and you've worked so hard to have these skill sets, and now it's like you see it real hand right in front of you. Yes, you'll see it in ERs and different things like that, but also when you're in the environment with those who are out there willing to sacrifice their lives for our nation, it's special. Like, it's like you feel like, man, I'm the luckiest guy in the world to get to do this, and knowing like I'm willing to give myself for them. And I remember specifically making that, thinking about that, going, I'm willing to lose it all when I go out here, because I'm willing to lose it, and I'll do everything to help the guys out there when I'm helping them, and I'm willing to lose that sacrifice that. That's okay for me, no matter what happens. And I think the people who are out there doing that, they make that call too. They choose to do that as well, and so there's no other greater feeling in the world helping them, right? And then when you do help them and they're so grateful, it's the best reward in the world. That's the reason why I love being a physician, and it's so rewarding. Yeah.
That's amazing.
Yeah, it is. We're lucky. We're blessed to have this opportunity. And whenever we're down or we're like, oh, it's so much work. Nope. Just remember, it's a great blessing.
Yeah.
It's a great blessing.
For the cause.
And gratitude changes around, and you're like, oh, I'm lucky to get to do this. I get to have this opportunity.
Yeah, definitely. And I think that helps. That is like the biggest thing that really helps, during the tough times, because medical school too, and I know you also understand the job sometimes you're gonna where you're required to make sacrifices and things.
Yeah.
So whether it be focusing more on school, focusing more on work, and then taking some time away from your family, and things that you might want to do at the time, but also just knowing that you've got that foundation of it being for someone else, and that it being worth it, in the end.
Yeah.
That you're not wasting your time.
Yeah. It's for something good. And even those times away from family, say, as you go along in your career and you have to go away from your family, your family appreciates it and respects you for it. Even your kids and your wife or your spouse will recognize that, we know you're sacrificing, and they sacrifice with you. And that's celebrating that with them, because they make a great sacrifice for not having you around. And it's not all the time. Like the military medicines, you're not going all the time. That's not expected of you, right? And so that's why I think it's a good mix, but you have these opportunities to go do that. And then you share that with your family and celebrate it, and as much as you can tell them and share with them those experiences. Yeah.
Yeah. Amazing.
So
and thanks so much, sir.
Oh, for sure, Alan. So good. Thank you for this opportunity, and I'm so excited for you as well.